every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Diarovite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diarovite from LB Pharma. Diarovite, love yourself.
The role of the eye in diagnosing systemic disease cannot be overemphasized. An ocular manifestation of a systemic disease or congenital condition may be its first visible presentation. The eye is a modified ball and socket joint with a transparent front viewing window allowing us to view signs which may suggest or confirm the presence of systemic disease. Awareness of these associations assists early diagnosis and may help anticipate or avoid complications. A significant number of diseases are known to present with ocular involvement, such as vascular diseases, diabetes mellitus, diseases involving nervous system, or rheumatoid diseases. Today on your favorite health TV talk show, The Physicians, we'll be discussing systemic diseases of the eye. Stay tuned. It's another day with The Physicians, where your health is our business and will always be our business. My name is Dr. Martina Agbere, your regular anchor on this program. And in the studio with me is our guest. He is an optometrist with Eye Care Family Vision Center. He's no other person than Dr. Kingsley Akiokpo. He will be talking on systemic diseases of the eye. Doctor, we are welcome to our program.
Thank you so much.
Looking really good.
Thank you. You look good, sir.
Thank you. So first we'll start with systemic diseases of the eye, right? So how can systemic diseases like hypertension and diabetes mellitus affect the eye? But before then, maybe because of our audience, so that they will understand where we're coming from, tell us about systemic diseases. What are systemic diseases?
Okay, talking about systemic diseases itself as a whole, are conditions that affect people from different variants. We have like examples that you've talked about, hypertension, diabetes. Now these are the most common. We have a lot more, rheumatoid arthritis. You can even call cancer a systemic disease.
So how can these affect the eye? For instance, maybe you want to break it down, or you want to take it in phases. Hypertension, diabetes, how does it affect the eye? So how can they affect the eye?
Okay, let's just focus on hypertension and diabetes for now. Basically because it's the most common in our environment at the moment. Okay. First of all, we have to define what hypertension and diabetes is. Yeah. Hypertension itself is when whoever has sustained high or elevated blood pressure. Now, the word sustained has to be really important, because you could just have like a bad day and your BP goes up. Doesn't mean you're hypertensive. But hypertension means that this happens over a long period of time. Now, as the consequences of this long period of time that we're looking at, that is what affects the eye, hypertension. Now, diabetes has to do with sugar. Now, for most people, they feel like diabetes is just taking excessive sugar, but that's not really the main problem, even though that's a factor. Other factors could also be, how does your body process the sugar? One, some people are born without the hormone that can process the sugar. Some people, based on their eating habits, such as foods that are high in lipids and so on, they prevent the sugar from entering the body. Now also, diabetes has to be sustained over a period of time. Now when you have excessive sugar over a period of time, it causes damages to the vessels and so on. So this is like a simple definition. Now, as I said, this has to be sustained over a period of time. And why the eye is like one of the most important parts when it comes to hypertension and diabetes is it's one of the few parts you can look at the blood vessels directly.
Okay. Is that the reason why it's considered the window into systemic health?
Exactly. Okay. Because it's basically the only way you can see into the body without having to open it up. We, eye specialists, we have like a machine that could just look into the eye. So we see the vessels, we see the blood vessels, and then the blood vessels tells us what is going on in the system. So basically, that's why it's called the window of the eye, as you earlier said.
Okay, so now let's break it down to diabetes, because we're going to zero on two main health conditions, hypertension and diabetes. So let's flow with diabetes.
Okay.
So why is diabetic retinopathy? What is diabetic retinopathy and how does it affect the eye?
Okay, diabetic retinopathy.
Yes, please.
I'll also state again,
Yeah.
sustained. Now, people who are diabetic, it takes a period of time before it gets to retinopathy. That is, before it gets to the part where it affects the eye. Retinopathy just means pathology in the eye. The retina, to be specific. The retina is like a film at the back of the eye that processes information. Now, when you have sustained sugar over a period of time, most times over 10 years or over 5 years, especially when the sugar is not properly controlled, like poor sugar, that means people that don't really take care of their sugar, it manifests in the eye and it can take the person's vision. Now, the very tricky thing about the eye itself is it's also very closely related with the brain. And for people who have like spinal cord injuries or brain injuries, you see that when they have this, it doesn't really heal. So it's almost the same thing with the eye. So that is how like diabetes itself affects the eye. Now, things that it affects are like blood vessels, basically, because every part of the body needs blood to survive. It, in a way, cuts the blood flow to the eye, and that is when the eye becomes affected.
Okay. So in simple word, it's actually sustained for that diabetic patients?
Yeah, especially the people with bad
control.
Yeah, control.
So if it's poorly controlled, the complications will set in early.
Earlier, exactly.
Is there any age?
Well, the almost every systemic problem comes over the age of 35 or 40. The body is a living tissue. At some point, it gets tired, so some of the things happen. All these systemic problems, most people are over 35 or 40. But it doesn't mean it doesn't happen in younger people. It does happen. There's what we call like juvenile diabetes, that's like type 1, that happens in people that are born with it, or it's hereditary. But most parts of diabetes is due to age and systemic habits or lifestyle, the way you've lived your life over a certain period of time.
So what are the presentation? How does somebody who has a diabetic retinopathy present?
Oh, people who have diabetic retinopathy, the first thing itself is the diabetes. So they need to have like a yearly check with your GP. Because when it comes down to diabetes with diabetic retinopathy and they start causing damages in the eye, the best we can do for you is to control the diabetes consequences. But the major problem is still the diabetes itself. So they need to see like a general physician, especially when you're above the age of 40. You're supposed to be doing like a systemic full test every year to know what's going on in your body, what are the new things you're finding, and so on. Yeah.
So I'm talking about the presentation. It probably will come like opacity in the eye. You can see very well.
Okay, in the eye, when you look inside, you see stuff like blood. That's like one of the worst complications of diabetes. Why? Because diabetes itself kills blood vessels. So over time, they get weak. It's like they're like let's use simple terms. You have like a pumping machine and then you have like the pipes. Over time, the pipes start to wear off. Diabetes is what causes the wearing off of the pipes. Then with time, when you try to pump water, it starts busting out of the pipes. So the blood comes out of the vessels and then it just splashes on the retina. That's one of the effects. Another is that due to the fact that the blood is coming out, it means that there's going to be poor supply to where it's going to. So over time, those things start to die. And when they start to die, you start to see like white patches on the retina. We call it like cotton wool spots and so on. What it basically means is there's an infarction. Infarction means that blood going to that part has been cut off, and then it just appears white, pale, in simple terms. Yeah.
Can it actually be a cause of a sudden blindness? Can it lead to blindness?
Yes, it can, but sudden is not it's not like particularly
like
the word.
Glaucoma?
Yeah, glaucoma or hypertension. Hypertension can cause stroke, basically in the body, which is like sudden, short or be cut full of blood. So hypertension will cause more of sudden, but diabetes is over time. Yeah.
Is this reversible?
Reversible, as I said earlier, anything has to do with the eye. Most times it's hard for you to reverse it, especially when the consequences has been there for a period of time. Okay. But the best people can do is to control their sugar at their time and always get like a yearly check. So what we'd always advise as doctors, physicians and so on is we want to catch it on time. So when you come to the clinic or you come to the hospital on time and we see it on time, we can manage it or maintain it, or at most do some of the damages, reverse some of the damages that it has done, but not particularly take it back to what it was.
Okay. So uncontrolled blood sugar can lead to eye complications.
Yes,
definitely. So why is it important now, okay, for people with diabetes to get regular eye checks? Why is it important?
Okay, people with diabetes, people with systemic conditions, is, as we said at the beginning, it's the window of the eye. So getting like your yearly check every year or sometimes every 6 months, depending on your history. Like you're supposed to go like get know your history. Somebody who knows they're diabetic or you have like a family history of diabetes or a family history of hypertension, you should do like a more frequent check, maybe like 6 months, 3 months, and so on. So, but when you get your yearly check, the doctor can tell you basically what is going on in your body, because the eye is one of the few parts that we can really see what's happening without you having to do so much tests.
Okay.
Yeah.
Wow. So from your diagnosis is when the patient comes in and you use your equipment
Yes.
to look inside the eye
yes.
and see. Okay. And you said it's not reversible.
To a very big extent.
To a very big extent. So it's always best to control it.
Yeah.
Now you talked about diabetes. Let's see if hypertension also has a role to play in the eye. Because it now looks like, okay, let me not preempt you. Yes, let me not preempt you at all. So what is hypertensive retinopathy? And what are the...
Okay. Well, I like to explain it in simple terms.
Yes.
So that
the big word, retinopathy. Retinopathy, that's a very big word.
Yeah. Well, retinopathy itself just means that there's a pathology on the retina. Okay. Now, what is causing it is hypertension itself.
And retina is a part of the eye.
Yeah, the retina is the film. Let's look at the camera. Okay. The film is what records the pictures that we take. So the retina is something sort of a film that records whatever we look at, and then the brain processes it. So it's like a midpoint between what we're seeing and the brain. That is why it's really important. Now, every structure in the body needs blood supply. But hypertension just basically means that over a period of time, something is happening with the vessels. It could be that poor eating habits, lipids or cholesterol are starting to build up in the vessels, reducing the blood flow to whatever needs blood. But in this particular sense, the retina. Okay. And also, this would also make the blood vessels really, really tiny or really, really pressured. And with time, they can also start to spill. Or the blood flow to the retina can be totally cut off. In situations where, because there's like a blood diagram in the body, a situation where there's like a big blood vessel block and there's a sudden total loss of blood vessels to the retina cannot stay more than at most 1 minute without blood. And if this happens, the person is blind. There's nothing that can be done, actually. It
can't stay more than 1 minute
1 minute without blood,
Are you serious?
Yeah. Even the brain can't really stay long. The brain can't really stay. That's why people faint, basically. It's because if there's anything happens with the body, the brain saves itself first. Yeah. All the blood goes there. So the body will have to shut down. Yeah. So almost the same thing with the retina. The retina needs blood. It cannot even stay up to 1 minute without blood. So once it gets that cut and it's off, the eye is blind. It's dead.
Wow, wow. So how emergencies, hypertensive emergencies?
For normal hypertension itself, when people even go to the hospital and their BP is like really high, the doctors don't even want to release them because they know what it can cause. Not just retina, but we're talking about the eye, but it can also cause stroke. But we also have what we call the retinal stroke, a situation where blood vessels are cut off to the retina and then the retina just dies. So, yeah. So I'm even more concerned about, well, they are equally bad conditions, but I'm more concerned about hypertension because of the sudden loss of vision that it can
cause. So how do they present in the clinic?
Hypertension, hypertensive retinopathy. Okay, so when they come in, we also need to do that test. So that is why a yearly check is super important, especially when somebody has a history of hypertension or diabetes. Let's say they've been diagnosed by their doctor. So coming every year, we can check the back of the eye. Some of the things that we might see are blood also, spilling of blood on the retina, death of cells. Okay. We can see that the vessels have started to thin out because of maybe plaques of cholesterol and so on. We can also tell your cholesterol level by looking at the back of your eye. Okay. If it's really bad, if you need to go see a doctor, and so on and so forth. So those are some of the presentations that we see.
Okay. Are there warning signs for somebody who has a hypertensive retinopathy?
The warning signs that you're hypertensive. Once you know you're hypertensive itself, you should just know that you should come and check.
So just asymptomatic, you will not have anything. And so it can cause, if you're comparing with diabetic retinopathy, which one is more dangerous?
The hypertension.
Because that one can cause sudden blindness?
Sudden blindness. Okay. But sometimes it does give like some warning, like some people have like blurry vision off and on. What that blurry vision means is that sometimes blood flow might be cut partially. Okay. So the eye might just go off and then blood comes back. So anybody that sometimes you see that your vision just go blurry and then after like some seconds it comes back and you're hypertensive, please go to the clinic.
Okay. So for all hypertensive patients, right? Yeah. that have good control, do they still come down with this? Not really.
No, the thing about all the systemic conditions now is about how do you control them. So we can't really tell if that will happen, but what we can tell is that if you control it properly, it won't happen soon.
Okay.
It might never happen in your lifetime, but it might happen. It just depends on your genetics
Okay.
too.
So considering the patients that have poor drug compliance and they are detected, right? You diagnose and say they have diabetic retinopathy, and they start to control their blood pressure. What are the chances that it will get better, and is it reversible?
Well, there's a very good chance. Let's say instead of it happening over flight, let's say you're using flights from one state to another, instead of it happening like that faster, it will slow down to like using like ship. So basically, what is going to happen is that the complication of the hypertensive retinopathy that's supposed to happen earlier, now that you're controlling your hypertension, will reduce that factor of it happening or coming on time. Yeah.
Okay, so you've talked about diabetes and hypertension as a systemic diseases that affect the eye.
Yeah.
Do you want to do a little bit of comparison between the two? How do the two, how do the effects of hypertension and diabetes, how do they differ?
Okay.
For a patient that has this diabetic retinopathy and one that has hypertensive retinopathy, what's the difference?
Well, first thing.
Because retinopathy is here, retinopathy is here.
Yeah, the first thing is the cause, the hypertension, the diabetes. Second is also the presentation. For people who are diabetic, they have symptoms like sometimes they feel tired, sometimes they pass out, and so on and so forth. People who are hypertensive, sometimes they have palpitations and so on. So in as much as we're talking about hypertensive retinopathy and diabetic retinopathy here, even we as eye specialists, we always like you to treat the background condition, which is hypertension and diabetes. If you can control this, at least to a very good state, it reduces the factor that you get hypertensive retinopathy or diabetic retinopathy on time. Okay. Yeah, so we hope that it doesn't get to that.
Because you've talked about diabetic retinopathy and the hypertensive retinopathy. So I'm just imagining, because we have some patients that are both diabetic and are also hypertensive, right? Is it possible for somebody to have the two at the same time?
Yes, it is. And that is actually very scary for us as doctors because it's a combination of two very bad conditions at the same time. The possibility of coming down with complications is really, really high. And sometimes looking at the back of the eye can make it really dicey because we're not sure if the problem is coming from the diabetes or the hypertension because they have similar presentation, just like very few differences that differs both of them, like what's causing it, and a few other stuff because they have almost the same complications at the back. So somebody who is diabetic and hypertensive would have like a 80% more chance of having a retinopathy, either from hypertension or diabetes. Wow. So yeah, so it's really worse than the normal one.
I don't want to scare my people, those listening now, especially those that are hypertensive or diabetic, that it's possible to have the two. I'm sure they are listening. Yes, Doctor, you have said a whole lot about the systemic diseases that affect the eye. You've talked about diabetic retinopathy, you've talked about hypertensive retinopathy. All they want to hear now is, yes, I've known I'm diabetic. It's possible that I'm going to have this. But if I do this, it will be better with me. Now let's talk about how can they prevent having diabetic or hypertensive retinopathy. These are talking about the lifestyle. We know the prevention, we always say, is better than cure.
Yeah.
So what lifestyles do you advocate that they take?
Lifestyle changes. Yeah. One of the most important is nutrition, the food, what you eat. I know we're in a state or an economy where things are like kind of hard to find good food. Good food in the sense that most of the things we have now are processed. Bad amount of sugar, processed sugar. Processed sugar is bad for the body because the body cannot really understand what it is. Processed means that it's artificial, so the body is not used to it. So when it comes into the body, it has a high chance of causing diabetes. So as much as we can, or as best as we can, let's take natural foods. Carrots, vegetables, so on. All these are antioxidants that help slow down these processes. Secondly, we can also talk about exercises. That cannot be overemphasized. Really, when you're getting to a certain age, you need to be less sedentary and move around more. Even if you cannot go to the gym and push like a lot, but at least take walks in the morning. This helps. It helps to burn down your sugar. It also helps to open up your vessels. So reducing you from both of those conditions. Also, when you know that you have like a family history, your mom or your dad was hypertensive or diabetic, you should also be very cautious about yourself. Get like a yearly check. Check what you eat. Eat proper food, fish, not processed food. As much as you can, if you're diabetic, avoid sugar, especially processed sugar. So yeah, these are like some few stuffs that can help. But the most important that I will always emphasize is nutrition. Eat properly.
Eat properly.
Yeah.
So, eat properly, you have said that, which we can't run away from it. So it just obviously means that diet has an important role in helping patients that are diabetic or hypertensive, okay?
Yes.
So are there some fruits that you usually would recommend that can help patients in our own environment?
Yeah.
What fruits do you really would recommend?
Carrots, banana, pineapple, vitamin C, orange. Orange is really important. It helps in healing.
How about the omega?
Omega-3 is also good, but you find them in fruits, but you can also really find them in fish. Like
what's the role of multivitamins?
Multivitamins, antioxidants, all this to just reduce the oxidation processes.
So finally, what should people with diabetes or hypertension do if they notice changes in vision?
Oh, please, they should run to the clinic. It's really important. They should just go to the closest clinic as fast as you can, especially when it's hypertension. Just run to the clinic so you don't have like a retinal stroke.
Okay, so final words for our viewers and our listeners. Just tell them something that will, at least the final word to them, advice or whatever.
Okay, yeah. So the eye, as I've been saying from the beginning, is the window to the soul. We can see a lot happening in the eye, vessels, so on and so forth. But going to the clinic at least every 6 months to get your eyes checked is a really important factor. Put it in your calendar, put it in your schedule. Just step into any clinic and get your eyes checked so you can prevent all this from happening. Thank you.
Thank you. Thank you very much, Dr. Kingsley.
You're welcome.
We really appreciate your coming, and kind of rest assured that we'll invite you again.
Thank you so much.
Because the eye is a window
To the soul.
to the soul. I love that statement. The eye is a window to the soul. That's how we will draw the curtain today on your favorite health TV talk show, The Physicians. We've actually been talking about systemic diseases of the eye, and it just narrowed down to hypertension and diabetes. And of course, he talked about diabetic retinopathy and hypertensive retinopathy. These are some of the conditions that usually would affect those that have diabetes and hypertension, especially those that are poorly controlled. So ensure you use your medications as recommended by your doctor. Don't joke with your drugs. These eyes are saying a lot of things can be detected that are happening in your body. So try as much as possible to keep your eyes safe. Visit a doctor at least once in a year for your eye check. But if you have health condition, he has said 6 months, every 6 months. When you know, don't even wait for that 6 months. The moment you notice that there's a challenge, your vision is getting worse, please run to the nearest hospital. The nearest hospital, you have to ask for an eye doctor to check the eyes. He also told us about the importance of diets and exercising. I can't go without telling you and reminding us of, we have always said it here on our program, that if you put the benefits of exercising as a pill, it will be the best soul pill in the world. My name is Dr. Martina Agberie. Be kind to follow us on our social media platforms. We have over 300 episodes now on our YouTube channel. If you want to be part of this program, like Dr. Kingsley, ensure that you go to our website, complete the form, and you'll be here. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.